RCPCH Podcasts.
Hello, my name's Ashley Rees. I'm a consultant paediatrician. I work at Watford General Hospital, part of West Hertfordshire Hospitals NHS Trust. And for the last 5 years, I've been the Officer for Assessment at the Royal College of Paediatrics and Child Health. I wanted to make this podcast to talk about some important changes to the training programme, and in particular, a new assessment that we've devised for trainees in light of the change of training as dictated by the Shape of Training review. The Royal College of Paediatrics and Child Health has submitted its new training pathway, which is a response to the Shape of Training document known as Progress Plus, coming just a few years after the change in the paediatric curriculum to become known as Progress. That's the paediatric curriculum. The key changes in the training programme are that the structure will change from a 3-level ST1 to ST8 programme to a 2-level ST1 to ST7 programme, where ST, of course, is specialty trainee. The positioning of the exams in this revised training programme will move so that only theory exams need to be completed by the end of ST3 before a trainee can take on Tier 2 middle grade rota responsibilities. So the clinical exam will need to be completed by the end of ST4. So that means that doctors will be able to work at middle grade level without their full membership exam. And because of this, the college have been working to devise a new assessment that will help bridge this change in training. And I'm delighted to say I'm joined by the immediate past trainee assessment representative, but now a consultant paediatrician at Norfolk and Norwich University Hospitals, Nicholas Schindler. Nick, thanks for joining us. It's great to chat.
Thanks for having me.
Thanks a lot for joining us to talk about this entrustment decision. We've devised a new assessment at the college, which is essentially a reworking of the ECAT, which is known as the Acute Care Assessment Tool, into an Entrustment with Care assessment tool known as an ECAT. And this is something that's going to be needed for the Progress Plus next stage curriculum, which is the Royal College response to the Shape of Training. So we're thinking about trainees particularly moving from what's going to be called Tier 1, which is currently more or less level 1 training, and into Tier 2, which is what we know as middle grade work. And the change for Progress Plus will be that trainees will need to have completed the MRC PCH membership theory exams by the end of ST3 that will allow progress to ST4, but the membership clinical exam will need to be done by the end of ST4. So trainees will be able to progress from core to specialty training without full membership.
Yeah, absolutely. And I think that's probably something that has already happened in a number of regions, really. There are probably people listening to this thinking that's quite familiar, but it's never been an official part of the structure of training before.
No, that's right. In some of the smaller schools, smaller deaneries, where there are less trainees, need differential cover and better cover. So, yes, trainees do move up at ST3 to work more independently in some places, as you say. So we've been thinking about ways that we can give trainees some formative feedback on how they're doing, particularly in those middle grade, what will be called Tier 2 tasks, activities, and that Tier 2 working.
Yeah, and I think we've definitely heard over the years from a lot of colleagues that they haven't necessarily felt ready to step up or weren't sure when they were ready to step up and wanted something that was relevant to them, that was almost a sort of badge that say, okay, you're ready to be a registrar now. And I think that the MRC PCH exams for some time haven't quite done that, especially as some doctors take them now very early in their careers, and therefore they're quite far removed from that step up to being a registrar. And some people sort of are looking for something that says, okay, I'm ready to do this.
So yeah, so the membership exam has some very important core skills that are required of doctors working at that level. Specifically, the clinical assessment and communication aspects of the exam are important middle grade skills. But you're right, some trainees feel that they need to have some more experience of doing that work and also have some observation of supervisors watching them in those roles, in those activities, so that they can be sure that they've got the right level of expertise to work at ST4 to work more independently.
Yeah, absolutely. And as I'm sure we'll talk about in a minute, I think that trainees want to be seen to do the job. Not that we think you're ready for it because we like you as a nice person, but we've seen you do the work and we know that you can do it. And we believe that you're safe to do it independently. And we trust you to do it independently.
So that leads us to think about the assessment that's been devised here, and it's known as an Entrustable Professional Activity, an EPA, as described by an educationalist from the Netherlands called Ollie Tenkate. And there's quite a lot of information and reference in the assessment strategy to the original EPA work and to some interesting documents that can help people understand what an EPA is. So the way this is going to work is something that we've talked about in our work together with the college's assessment executive. And it's clear that working at ST3, there's an opportunity to step up and to do some of those activities that a middle grade ST4 doctor will do.
Yeah, I think that's in some places very much the case, in that there's an opportunity as an ST3, as an SHO, if I'm allowed to use that term, to step up, to hold the registrar bleep or whatever euphemism you want to use. But I also think that in some places that doesn't happen, and so structuring things in the way of a workplace-based assessment like the ECAT or an EPA allows centres who maybe don't do that already to start to develop structured processes by which doctors at sort of tier 1 can then start to undertake tier 2 work in a supported and supervised environment before they're at a position of doing it at 2:00 on a Sunday morning on their own.
So that's right. So there are a number of tasks and activities that ST4 doctors undertake, and we've thought about some key core activities that we think are important. So those would be a general paediatric ward round, an outpatient clinic, on the neonatal unit, admitting a term or a preterm baby, and running the acute take. So those are the key activities that we're looking to offer some support to ST3 doctors working at that level to rehearse, if you like, the knowledge, skills, and attitudes, the individual units of professional activity, history taking, communication, supervising your team, liaising with seniors and others appropriately, in order for them to demonstrate that they've got the skills to be able to manage those tasks and those activities independently.
Absolutely. And what EPAs, or in this case the ECAT, does is really, I think, take the processes that happen already, in that other people view your practice in the round and make a judgment about your abilities and will provide you feedback or discuss feedback with you informally, and make that into a formal structured process that has an evidenced output. So there's two parts. There's the structure to facilitate feedback in units that maybe do it less naturally than others. And then there's also the evidence at the end of it, that you get something out of it that says, okay, I'm entrusted by my boss, by my team, to independently undertake this process.
So that's really important, isn't it? It's that entrustment decision that we're suggesting the supervisor makes, and it may be that there are more than one entrustment observations of these activities, and it may be that entrustment decision is a decision discussed with the whole faculty. In fact, that's probably desirable to get some, triangulation of opinion on working in different areas with different people, probably.
Yeah, I think so. And the important bit for me is that we're moving away from this concept of the mini KEX or the CBD, where you have a single discussed or observed event, at which point someone ticks a box and all of a sudden everything's okay because someone watched you do one cannula or one intubation, to a more sort of longitudinal overview of, this group of people have worked with you for 6 months, and on the basis of a number of events in that 6 months, they've come to this conclusion that they trust you to do this. And if for some reason they don't yet trust you to do it independently, they feel that maybe you need some more present supervision, they're then obliged to give you really clear and structured feedback on actually what is it that will get you to the next level. So where do you have to focus your work, your own development, to be able to undertake these activities again independently at 2:00 on a Sunday morning.
Yeah, so the idea here is that the ECAT assessment covers all of the progress domains, certainly some of the main clinical domains, and then there are some optional ones around teaching and safeguarding, should they be relevant. And there's some formative feedback in each of those areas. And the supervisor would feed back to the trainee, just like any other workplace-based assessment or supervised learning event, what went well and any areas that they can develop in the future, if there's anything there that they think they need to sort of move them on to that next level. And the ECAT assessment, like many of our assessments, we hope will be trainee-led. So, a trainee in their ST3 year can use an opportunity of care, some on-the-job learning, training, support to get an ECAT done so that they can get that in their portfolio and then show some developmental progression maybe over the year. So use the assessment as part of a developmental conversation, which is a really good frame in which to think about workplace-based assessments.
Yeah, I think it's a nice thing to do with those tricky mid-placement meetings where you've not had any big issues crop up, things are going okay, you're looking for a bit more structure than ambushing someone with a few tickets for a mini kex to go to and say, okay, well, these are the new ECATs, let's have a look at them. What have you as my supervisor watched me do? What can we talk about? And for your supervisor to then go back and to their consultant colleagues, and as we often do as consultants when we email each other to say, oh, I've signing off this trainee, has anyone got any feedback, to go through that process and really collate the faculty's opinion into an entrustment decision at the end of it.
Yeah, that's exactly how we hope it will be, and of course, using assessment for learning in this way is one of the principles articulated in the Paediatrician of the Future document that accompanies the Progress Plus curriculum.
Yeah, and I think that distinction of assessment for learning or formative assessment versus that assessment of learning has over time shifted in portfolio and in the way we use workplace-based assessments, in the way that people who've come through the foundation program more recently will be familiar with supervised learning events that sort of were rebranded with that deliberate aim of moving away from the concept of summative assessment. And yes, at the end of the ECAT process, at the end of the EPA process, is this summative decision effectively of I trust this person to undertake this work independently. It's about the journey. It's about how you get there. It's not about someone ticking that box at the end of it and putting their name next to it. It's very much about using the structure of the journey to support that learning process in a way that I think probably happens very often in pediatric training in some places, but not everywhere and not all the time. And that's the key to it.
Great. So, in summary, then, the ECAT is an entrustment with care assessment tool that trainees in ST3 training year in Tier 1 training will use with their supervisor to get feedback on their Tier 2 readiness. And the feedback should enable trainees to reflect and focus on their development towards the next level of responsibility. And we hope the ECAT is going to be used by trainees and their supervisor to record observations, maybe multiple observations, undertaking normal middle grade activities such as a ward round, outpatient clinic, running the acute take. And this ability to feed back on aspects of performance, acting up, will help supervisors and faculties give specific feedback to trainees and give them that confidence to be able to know that they can function like an ST4 doctor. And this is important in the shape of training because for entry to Tier 2, it's only the membership written exams that will be mandated, and the clinical exam can be passed up to the end of ST4.
Yeah, absolutely, actually. And I think that the key point in all of this for me is that it's an assessment based on actual activity. So for us in paediatric departments across the country, we need to be looking at ways that we can provide that activity for our ST3s, for our SHOs, so that they have the opportunity to act as registrars in a supported and observed capacity prior to taking on that work as part of their formal job role.
RCPCH Podcasts.